And researchers have been looking into the effectiveness of telehealth over the course of the pandemic. One local study says the practice has been extremely beneficial for many. Ericketta Cost is looking into this for us. She joins us in the studio with more. Ericketta.
Good evening. Doctors in our region say a major shift to telemedicine happened overnight. They went from hundreds of patients utilizing the service to hundreds of thousands. Two major health systems in our region really stopped to take a look at how it's made an impact, and so far the results have been positive. After the first surge of COVID-19, it was time to take a look at the effectiveness. Dr. Michael Hasselberg with URMC co-authored this study.
Was this working? Was it helpful for our patients? Was it more costly to do it this way?
Fast forward to now, we're seeing those findings come to light from earlier in the pandemic.
We essentially looked at patients that received care from us via telephonically or video consults, and we compared those patients to those that didn't receive care via telephonic or video.
They also examined common critiques and found them to actually be myths. For example, he says according to their findings, telehealth did not reduce access to those most vulnerable. It was the opposite.
In those rural areas where transportation is very limited, and that this was a medium that they could overcome those transportation barriers and receive the care. New York has invested over the years quite heavily in broadband access.
Cole Nardi, director of telehealth with Rochester Regional Health, says they have similar feedback, with over 90% of patients saying it was sufficient and they'd use it again.
So we partnered with a company called TitoCare to do at-home peripherals, in which a patient can use this device to be able to attach a digital stethoscope and let the provider actually hear the heart and lungs in a video visit.
And now that URMC study also found that providers do not order excessive amounts of additional testing to make up for limitations of virtual visits. Patients don't end up in the ER or hospital because their needs aren't met during telehealth, and they don't require additional in-person visits to supplement. Now, as far as challenges go, Nardi with Rochester Regional Health says there will always be that challenge of the digital divide there. He says they're working to remove barriers when it comes to having devices and internet access, and just this past month, he says they started implementing those digital devices you saw into emergency housing shelters in our region. In the studio, Ericketta Cost, News 8.
All right, Ericketta, thank you. URMC is one of the first organizations in the country to publish a study about the quality and potential cost savings telemedicine could have compared to in-person care. They've since been featured in the high-profile New England Journal of Medicine.